Okay, and now to the reason that we are here. We're fortunate to have two great speakers with us today. I'd first like to welcome Fadi El-Jardali, a professor of health policies and systems, director of the Knowledge to Policy Center, co-director of SPARC, the Center for Systematic Reviews in Health Policy and Systems Research, and co-director of the Nodal Institute at the American University of Beirut, Lebanon, in Lebanon. He's an adjunct professor at the Department of Clinical Epidemiology and Biostatistics at McMaster University in Canada. His research activities, publications, and interest are focused on health policymaking, knowledge translation, governance, performance reporting for health systems and organizations, quality of care, accreditation, patient safety, and human resources for health. Kaelan Moat leads the maintenance and ongoing content development of health systems evidence, the world's most comprehensive free access point for high-quality evidence about how to strengthen or reform health systems. He also helped in the development and now leads Health System Learning, an online learning resource for health system policymakers and stakeholders who are committed to making evidence-informed decisions. His research focuses on how to support the use of research evidence in health system policymaking, with a particular focus on both the evaluation of innovative mechanisms designed to increase the likelihood that research will be used to inform policy decisions, and on better understanding the influence that political factors have on these mechanisms and their use. Welcome to both. Fadi will start today's discussion by setting the context, then he will share his top 10 lessons learned from developing and implementing novel approaches to support evidence-informed health systems. Kaelan will share his thoughts, and then we'll open the webinar to questions and answers. But now, please welcome Fadi.
Thank you, Stephen. Thank you, Kaelan. Thanks for the McMaster Health Forum for the opportunity. Good morning, good afternoon, good evening, depending where you are now. It's my pleasure today actually to introduce you a little bit about the Knowledge to Policy Center here at the American University of Beirut in Lebanon, and then share with you some of the lessons that we have learned from the work that we have done over the last few years about knowledge translation. So just to give you a little bit of a context, we operate in a country where it passed through civil war, many years, more than 10 years of civil war. The state itself is fragile, is weak, limited governance capacity, and we have a rapid growth of the expansion of the private sector and the non-governmental organizations. So this is in terms of the governance when it comes to the health systems. We have 6 governorates in the country, and the country now is hosting almost 1.8 million Syrian refugees, up on the top of the 4.8 million in terms of the population size. So we have over the last, since 2011, we witnessed an increase of more than 30% to the population living in Lebanon. We have a parliamentary democracy, over 30 parties, in fact, involved in the political system, touristic healthcare system, private sector as a main source of financing and delivery. And we have still, despite the significant effort that has been made over the last few years, still we have high out-of-pocket expenditure in the range of 40%. The reason why I'm mentioning about the context as well as some background information, because to show you that when we started the center, the center came to be as a result of the work that we have done in the region based on the research. We have done a survey of 237 policymakers in 14 countries from the Eastern Mediterranean region, and we found that most of the policymakers, more than 88%, reported requesting evidence. However, less than half reported collaborating with researchers or receiving research evidence at the right time and in a user-friendly way. Many of them, they indicated that systematic reviews on high-priority issues were rarely disseminated to policymakers. Another study was conducted in 6 low-income countries in the region, highlighted the need for a better packaging of research results. So we started to look very seriously into those results. We also went after researchers, and we've done a survey of 238 researchers from the region. And this study revealed that less than one quarter produced policy brief, disseminated messages that specified possible action, or interacted with policymakers and stakeholders in priority setting exercises. We've done also a situation analysis exercise, and we found that, in fact, very few studies that actually had been produced response to priorities that as voiced by policymakers in the region. So all this to say that, based on all this evidence that we generated from the region, we realized that really we need to have a knowledge translation platform, and we discussed this within our university at the American University of Beirut, and the decision was actually to create a center called Knowledge to Policy Center, K2P, with a forerunner in synthesizing evidence, contextualizing knowledge, and engaging stakeholders to impact health policy and action in Lebanon and the region. This center has been modeled after the McMaster Health Forum. I had the opportunity to spend some time at the forum, and I have to tell you, we benefited a lot from the experience of McMaster Health Forum, with also advice from Dr. John Davis. So this is a center founded by the Faculty of Health Sciences at the American University of Beirut, with seed funding from the International Development Research Center, IDRC in Canada. And since 2015, we have been designated the WHO Collaborating Center for Evidence-Informed Policy and Practice. This is the core functions of our center. We do priority setting exercises. We produce knowledge to policy products. We have 6 products that we produce. We conduct policy dialogue. We have started now to actually do evidence-informed advocacy. We conduct policy tracing research. At the same time, we also deliver and provide capacity building workshops, both for policymakers, researchers, civil society groups, as well as media. This is the approach that we are, in fact, using in our work. We call it an impact-oriented approach, meaning that we always look at what we would like to achieve at the end of using knowledge translation tools that is really available out there. Once we look at the impact that needs to be achieved, we definitely, these are the steps that we follow. We engage policymakers and stakeholders when identifying priorities. We also engage civil societies and citizens. We understand very well the political context in Lebanon. We are very much vigilant to what how policy decisions are being made. We engage in formal and informal discussions. Based on that, we identify priority areas that need work. We also we have another center at our university called SPARK, Center for Systematic Reviews in Health Policy and Systems Research, where we also, if we have sufficient time, we conduct systematic reviews. We're scaling up now to rapid reviews, and in some cases, we support some primary studies. But we very much focus on evidence synthesis, and we actually package that evidence in different products, including policy brief, evidence summaries, briefing notes, rapid response products, and there's a specific product that we produce called for media, for journalists, it's called Media Byte. After from priority setting, so we identify priority question, we do evidence synthesis, we package a knowledge translation tool, and also we work on knowledge uptake through policy dialogue, engagement strategies, advocacy, media engagement, as well as political engagement. So this is the approach that we are actually working on. So we as much as we can, we try to be impact oriented. This is just briefly about SPARK. So this is one of the 4 systematic review centers in health policy and system research, and this is the first of its kind in our region. This is joint collaboration between the Faculty of Health Sciences and Faculty of Medicine. This was founded in 2013 with funding from the Alliance for Health Policy and System Research, and now SPARK was recently appointed to host the Secretariat for the Global Evidence Synthesis Initiative, GESI. So I just want to show you that we're also leveraging and working with other centers and entities, and keeping in mind or focus with a special focus on impact. These are sample of the K2P product that we produced, and each of those products has its unique features. And of course, everything is really available on the website for K2P in case you would like to see examples of some of each of those products at what unique features it's included in the, so we have a policy brief, a briefing note. A briefing note includes recommendation. We have evidence summary. We have a dialogue summary. We have a media bite. This is a product focused on for media and journalists, and we have a rapid response program. In terms of our scorecard for the last 2015-2016, we produced again a variety of those products on different priority areas. We also have something called K2P press tracing. So we actually, on a daily basis, our staff is actually reviewing, doing media analysis for all the main newspapers that is being produced in Lebanon. We identify articles related to health system, public health. We have a criteria to do that, and as well as we evaluate and rank those articles, the ones that focus on evidence versus the ones that are really mostly based on a certain rhetoric or has some political agendas behind it. And we actually produce this report on a weekly basis, and we send it to all stakeholders. So this is just quickly also an example of the impact that we have achieved. So we have done one in 2014 about promoting access to essential healthcare services for Syrian refugees in Lebanon. And we were among the first centers in Lebanon to start addressing this based on an evidence-informed approach. As you know, Lebanon is very much hit with the Syrian crisis, and we are still having and witnessing a massive influx of Syrian refugees coming to the country. As I said, we have more than 1.8 million refugees in a country of 4.8 million. So we, based on the work that we have done, we developed a briefing note, we conducted a dialogue, we brought all the stakeholders around the table, and this was led to strengthening the Ministry of Health National Information System, Refugee Health. We were able to have a refugee health response coordinator now at the Ministry of Health, and the work has also guided the development of the strategic plan. We also made impact when it comes to medical errors. So we produced a policy brief, conducted dialogue on medical error in Lebanon, and now a decision was made based on the work that we have done. The whole accreditation system in Lebanon now is being revised to integrate patient safety goals and indicators related to safety. The contractual arrangements with health organizations are being revised based on the work that we have done. There's a new governance model for the accreditation program as well. We've also worked on mental health. Just an example, where also we produce a brief. We established, now there is a mental health and psychosocial support task force to coordinate efforts across Lebanon. There was initiative that was initiated as a result of the work that we are doing. And now there's also a mental health strategy that is really guided by the work that has been produced. This is an interesting example where we also made an impact by issuing a new ministerial decision by the Ministry of Health mandating and monitoring salt iodization within a recommended rate. So this is also has been achieved over the last few months. We have also worked on prescribing patterns and quality and patterns of pharmaceutical drugs in Lebanon. And now there's a revision happening for the Code of Ethics for medicinal products promotion. There is an establishment of standardized definition for clinical pharmacy and scope of practice. And this is just an example as well of some of the impact that we were able so far to measure and to witness as a result of this work. The last example I want to bring is also we were able, through a rapid response product, and this is basically based on a question that was asked to us by the Minister of Health at that time. And he just asked a simple question: shall we go with the law 178 in Lebanon or not? Are there any harmful consequences of that? And he wanted the answer in a few days. We produced a rapid response, and we were able, in fact, to stop the implementation of the salt fluoridation law in Lebanon as a result of this initiative. We have been very much engaging with media, so much of the work that we produce has been actually picked up by media, and actually it was, in some cases, it was used in a strategic way, where also it was the result was widely disseminated, but also it initiated a good discussion in the country on some priority areas, and we diversified our relation with media to include print media, TV, social media. So just quickly on what we have done so far, just an example, and based on, and I have to tell you, we have been learning almost on a daily basis with some of the work that we are really doing. But we're going to focus on the top 10 lessons learned so far from the work that we are doing. In terms of lesson one, we call it the three rights: right priorities, right timing, and right framing. In terms of the priorities, we have learned that it's very important to identify priorities through different modalities or different venues. One through priority setting exercises that can occur on a periodic basis, but also to be able to receive direct requests from policymakers, parliamentarians, legislators, politicians. But at the same time, we are always vigilant of some focusing events. So we don't only respond and react to the request, but also we try to shape the agenda by bringing in, for example, the issue around interaction between pharmaceutical companies and physicians, the issue of medical errors. It was us, in fact, that we initiated it because we wanted to influence the policy agenda. So our approach is both proactive when we feel that really there are priorities that need to be addressed, so we can guide and shape and influence policy agendas, but also our approach as well take into consideration the requests or the priorities as voiced by the policymakers, stakeholders. Certainly right timing, and I tell you that there are several products that we have started working on, but we always try to identify and leverage on policy windows of opportunities, which sometimes it happens. And for example, now we have a new government, and the new government they will stay with us for a few months before there is election for the new parliament, and then another new government will be formed. So we take into consideration the political context very well to see what is the perfect timing to get something out and engage stakeholders, policymakers in a dialogue. Right framing, the framing of the problem should be evidence informed, but at the same time should be contextualized and with a focus on health outcomes. So we very much make sure that whatever problem we say, we put it out there, it's really based on evidence. We quantify it. We look at the underlying factors related to the problem. We very much leverage on the local evidence, which I'm going to talk about shortly, and with a specific focus on health outcomes. So our approach to framing the problem is engaging. For example, if we went when we talked about pharmaceutical companies' interaction with physicians, if we went with a blaming approach or confrontation approach in the way we are framing the problem, certainly many of the participants or key stakeholder organizations, including order of physician, other will not come to the table. We have to frame it in a way that is non-threatening and making sure that people or stakeholders focus on the end outcome, which is really improving population health. The lesson number two is really very much that we need to understand the current political system. We need to understand if we want to succeed in knowledge translation and we want to influence decisions, we need to we need to understand how public policy are made, who are really the policymakers, who are the key influential organization in the system. And for example, in Lebanon, Ministry of Health is a key decision-making institution when it comes to health. So this is really a major stakeholder that we actually need to work with. And with the right approach, we've learned that legislators can be open to evidence. We had made several visits to the parliament. We sat with the Parliamentary Health Committee. We talked to the president of that committee. So that building public relation to facilitate access to policymakers and politicians is extremely important. But at the same time, what we have done is we're trying to always create demand for such work by conducting capacity building workshops to policymakers, to civil society groups, to researchers, in order also to increase the demand for this work. Lesson number three, engaging policymakers and stakeholders throughout the whole K2P process. And what I mean by that, it's very important whenever we go and ask policymakers what are the key priorities that they have or the key concerns that they have. is that we keep engaging them throughout the whole process. So basically, from priority setting exercises, we engage them in discussion, we tap into their tacit knowledge, we work with them to see what has been produced in terms of local evidence. We do interview with them, so we call it litmus testing, where we actually go and whenever we have an outline that includes the problem, some suggestions about options or elements for solution, and we actually go and meet with some key stakeholders. And again, we benefit a lot from the model also that McMaster Health Forum has, and we adapted that approach. We engage them in a deliberative dialogue, and now we are scaling up as well in terms of advocacy, as well as measuring the impact. So what I'm trying to say is that we actually always try to demonstrate that engagement is important, and engagement should be at multi-level and throughout the whole spectrum of from priority setting to synthesis to translation to uptake to impact. Lesson number 4, it's very important that we incorporate local data to contextualize the evidence. We had some challenges, in fact, where there were some important priority topics, but still we couldn't find a lot of high quality local evidence. So this sometimes it's challenging, but we have to work and leverage on whatever is already there. We try to contextualize the evidence that is already out there. We try to tap into the tacit knowledge of the key stakeholders, policymakers. We make sure that we know what is really available out there, how relevant. We also look at the quality of the local evidence. Sometimes we are being challenged. There's a lot of unpublished or gray literature that sometimes we have to actually do snowballing and ask people so we can get access to. But sometimes definitely we are challenged, but the reality of the availability of local evidence, the quality, the relevance, the applicability, and also discrepancies. Sometimes we have some studies that is being done at the local level. The design of that study is quite challenging, but policymakers are trusting very much that evidence. But when we compare it to systematic reviews and to global evidence and to high quality evidence from different contexts, there's really major differences and discrepancies of finding. And I tell you from our experience, usually policymakers and stakeholders, they are more attentive to local evidence. Not to say they don't appreciate systematic review, in fact they do, but they would like to see a product that combine and harness the best available evidence both at the global level, regional level, as well as national level. Lesson number 5, absolutely policy brief and policy dialogues are highly valued knowledge translation tools. So it's very important to use them. We have, in fact, we've conducted several or produced several products, we conducted several dialogues, and we evaluated all of those products and dialogues. And I tell you that actually we get very, very interesting evaluation. They provide opportunity to bring together global research evidence and context-specific knowledge. We go and try to make sure that whatever is up we put in the draft is also context specific by doing interviews. The dialogue that we actually conduct is create a platform for the interaction between policymakers, researchers, and other stakeholders. And I tell you that we are still working hard to try to identify the best mechanisms to integrate tacit knowledge and other forms of evidence, local evidence, evaluation finding, others in the policy brief that we were to produce. We're still in level 5. Although policy brief and policy dialogue are important and highly valued, we argue that they may not be sufficient to achieve impact. And we are starting to learn more and more that while people get excited about the brief and they get very much energized when they come to the dialogue and they get really excited, but we realize that more work needs to be done for certain topics post dialogue. So yes, we produce dialogue summaries. We are doing post dialogue assessments. We're doing debriefing to specific stakeholders. But we feel that we need more and more work closely and follow up with key stakeholders to address implementation consideration. We need to more and more engage politicians and policymakers in terms of the implementation. And now you will see later on we are actually also scaling up to start more and more systematically engaging citizens and civil society groups in helping moving forward in advocating for some options or elements that in fact all stakeholders feel that this is the way to go, but there are some challenges when it comes to implementation. Lesson number 6, involving media is important, but also from our experience could be double-edged. So absolutely in Lebanon, because of the nature of the democratic system that we have a strong presence of media in Lebanon. We have diverse set of media outlets in Lebanon. And no doubt they are able to mobilize public opinion and in fact exert certain pressure for policy change, sometimes for the right reasons, sometimes for the wrong reasons. But I'm sure, and you are aware that working with media sometimes is quite challenging because they have sometimes selective slash I wouldn't say opportunistic approach, but that they very much sometimes focus on the sensational stories, and sometimes they put things in a way that, or they frame a certain problem differently. And I'll give you an example. Last week, I got a call from the president of the Order of Physicians in Lebanon. He was on the policy dialogue where we discussed about the patterns of prescribing patterns of physicians and how we should rationalize that. And he was happy about the whole process. But there was one journalist that put an article in the newspaper, and actually the journalist was blaming physicians and that they are taking bribes from pharmaceutical companies, etc., etc. And he called me not to blame us, but he said, we are happy with this whole approach, but we should more and more work with media to make them actually write in an evidence-informed way. And I think this is a message well received. Lesson number 7, we have to be ready to provide rapid response, no doubt. And I gave you an example about salt fluoridation. The minister called me in his office and he asked me this simple question in a meeting less than 5 minutes. And he said, I want an answer for that because I'm going to the cabinet and later to the parliament, and we need to know whether we're going to issue that law or not. So scaling up to rapid response services is very important. But more importantly, we need to make sure that we are ready to respond to policymakers and stakeholder needs. So this means that in the knowledge translation platform, in any center or unit, we need to make sure that we have the right mix of technical, managerial, and communication skills and capacity to undertake evidence synthesis and use innovative KT and advocacy tools to support the implementation of policy. Lesson number 8, certainly institutionalization is a key to sustainability. And here what we mean by institutionalization, we're talking at different levels. One is really, we're starting to believe more and more, it's very important that we institutionalize relations with policymakers and with government. Why? Because, as you know, in policymaking institutions, there's always high turnover, particularly if you're working closely with certain politicians. So that institutionalizing relations with government is extremely important as long as we keep objective, we make sure that we're not being captured by the interest or by certain political interests. And I think so far things have been really working, but the relations need to be institutionalized more with some key institutions. The location of the knowledge translation platform is important, and in the case of our center K2P, we are located in a credible university in Lebanon and the region. Certainly, the university and the leadership of the university provided support and to the making of that center, but we feel more and more that any knowledge translation platform, particularly if they are hosted or located in a university, the university back up to the center is extremely important, and also the institutionalization of the center is important. At the same time, one last thing about institutionalization is that we are also in a country or a region where still the use of evidence in policymaking institutions is not very much recognized or institutionalized. So there is no clear structured mechanism in ministries or in parliaments where they have to show explicitly the type and the quality of evidence that is really, or that they have used before they make decisions. Not to say that still we have a poor accountability frameworks, that it's hard still yet, but I think some good significant strides are being made as we move forward. Lesson number 9, you need to demonstrate value through success stories, and I think it's very important. We were really surprised because when we started engaging with policymakers and stakeholders, we felt whenever we talk about knowledge translation, policy brief, policy dialogue, high quality evidence, systematic reviews, we used to take it for given that people really understand what we were talking about. But unless and until we started to show them, we demonstrate to them what we do, we show them some success stories, the aha moment came to them. This is what they felt. Now I know what you mean. Now I know how important that we do actually the policy dialogue. Now I know how dialogue are being facilitated. Now I know that we should really go and seek and harness all the available evidence out there before we go and discuss in an evidence-informed way. So the demonstration of the value is extremely important, and this can happen through strategic communication, demonstrating high degree of responsiveness to priorities and needs, maintaining continuous and close relationships with stakeholders to make sure that you create trust, but also you maintain and you sustain trust. Remaining objective, truthful, and politically neutral is extremely important. Extremely important. We had cases where we said no, meaning we didn't really intervene and we didn't really make a statement because the topic was really politically charged and there was a lot of vested interest in the status quo. So we have to be careful that we don't get captured by any interest. And so far, we have a strict rules and policies and procedures to deal with that. Certainly, sustaining credibility and accountability is extremely important. Lesson number 10. Impact certainly is the driving force for the entire knowledge translation process. So we have to measure it. And this is what I mentioned earlier, that the approach that we are using, which is really impact-oriented approach, we always keep an eye on the impact. Sometimes we start from visualizing or understanding the impact that we would like to achieve, and then we actually move backwards to see what are the steps that needs to be done to achieve that impact. So impact-oriented approach is important. We need to specify the desired impact from the very start, but also we need to be persistent to realize that impact. And sometimes it's challenging. And I'm not saying that we are really we have succeeded in realizing all the impact of all the work that we have done so far, but we are actually trying hard to move into that direction. Certainly, we need to establish different ways to measure impact, not only through surveys, interviews, but also through policy rating techniques and other indicators. So it's very important. And I know that there is a lot of good work through the IBIPNet to actually work and identifying key metrics around measuring impact. So to recap on the lessons, so we have 10 lessons that we have learned so far. The 3 rights, right priorities, right timing, right framing. Understanding the political system is very important. Engaging policymakers and stakeholders throughout the whole knowledge translation process is critical. Incorporating local evidence or local data to conceptualize evidence is important. Policy brief and policy dialogue are important but not sufficient in order to achieve impact. Involving media is important but double-edged. We have to be ready to provide rapid response. Institutionalization is a key to sustainability. Demonstrating value is critical, and no doubt that measuring impact and realizing impact is also a key driving force to ensure that the knowledge translation process is achieving its intended results. My last slide on this is just to again, and this is part of the lessons that we have learned so far, is that we are now pilot testing a K2P advocacy strategy. We have a advocacy officer that is really working with us now, and we've developed and now we are pilot testing the advocacy strategy that we have developed on a particular priority area. We are scaling up to a rapid response system in collaboration with Spark. We are pilot testing as well a K2P citizen engagement strategy, and we are also implementing data visualization to support evidence-informed policymaking. Thank you for the opportunity again, and thanks for listening.
Well, thanks very much, Fadi. Those were certainly very insightful lessons learned. Sorry, I just tried to open a poll here, but I realized it's not quite showing up properly. But maybe what I could ask then is that for people on that are online, maybe they could just share in the comments in the chat box. If there's any particular of those lessons that they found to be more insightful or relevant to their own work and their own context. In the meantime, I'd like to now ask Kaelan to share his feedback and his comments on those top 10 lessons learned in the Canadian context and certainly in our experience with the McMaster Health Forum. Kaelan?
Thanks, Steve. Can you hear me okay?
Yep.
Great. So thanks, Fadi, for the great presentation. I know that you and I have been on many panels together, and I still learn new things every time I hear the experience at the Spark and K2P Centre in Lebanon. So I wanted to weigh in basically with two overarching big reactions that I have when I see all of the things coming out of Lebanon. And I preface what I'm about to say by kind of highlighting that I'm coming from a position where I both serve as a practitioner, so doing a lot of the things and activities that Fadi mentioned, but also as a researcher. So I'm really interested in evaluating how these things are actually influencing the policy process. So my big two buckets of reactions are, first, we should collectively as a group, everyone on this webinar is obviously interested in the topic enough to be considered engaged. So as a group of engaged practitioners and perhaps researchers, we should all acknowledge what we know work across settings. So what we know from all of our experience that are no-brainers, and we just need to keep doing these things well. So the first thing kind of falls within process. Fadi mentioned in lesson 1 that we need to get the timing right and the framing right with whatever we do. We need to understand the context, which was his second lesson. Engagement, interaction throughout the entire process of whatever we're doing is essential. So that was his lesson 3. So from a process perspective, we know if we get those things right, we're off to the races. In terms of outputs and outcomes, based on Fadi's lessons 5 and 7, we know that rapid responses, briefs, dialogues, as well as a supportive complementary product such as dialogue summaries are absolutely essential pieces of the puzzle. So they're highly valued. We're finding that they lead to strong intentions to act. However, we do know that we can't expect them to achieve impact alone. And that's where Fadi mentioned there are some opportunities for us to evolve further, which I'll get into in a second. So in terms of local data, I agree that it's completely essential for us to find out how to best contextualize this. We know that it matters, so we need to take reviews, but also contextualize with local data. So that was Fadi's lesson 4. And in terms of impacts, anecdotes and success stories are absolutely essential to get buy-in from the key stakeholders we're hoping to engage with and influence. So that was his 9th lesson. We need to do good formative evaluation through things like surveys and interviews, which is his 10th lesson learned. And I also think that we can leverage things like testimonials, which feed into the anecdotes as well. So that's the first big reaction. Those are the things we know that are consistent across settings, and we need to do them well. So I also highlighted, and this was more of a reflection on what Fadi mentioned, as areas that are ripe for innovation and things that we, as a group of both practitioners and researchers, could focus on in the next 5 years while continuing to do all the things I just mentioned well. Focus on these things as real areas for innovation that we can just become better at what we're doing. So the first area is understanding what sustainability and institutionalization actually means. So this relates to Fadi's 8th lesson. I think we're now just getting to the point where we're learning what sustainability and institutionalization means, specifically given the fact that context matters tremendously when we're considering how to make our efforts sustainable. So if you're located in a Ministry of Health somewhere, your facilitators and barriers to making your KT efforts sustainable are going to be completely different than Fadi's, who's located at a university setting, and even more different from what we face in the McMaster Health Forum, located at a university but not necessarily 100% embedded within a faculty per se. There is research coming out at this point from colleagues such as Dr. Zita Andre, Tanya Kukimuller from the WHO EVIPNet group in Europe. They're focusing on this question. So hopefully in the next couple of years, we'll get to understand a bit more about the factors that influence sustainability of KT efforts. The second one that relates to Fadi's sixth lesson was the involvement of media. So we haven't really done this systematically at the McMaster Health Forum, and I think that Fadi's lessons can give us all insights as to the major considerations that need to be made when we're engaging the media. So the media tracing is a completely innovative approach to both tracking what's on the agenda as well as what the media are likely to focus on. But the warnings that come out of the K2P Centre are something that everyone here on this webinar should pay attention to, because I think we just don't really know yet the role that media will play in knowledge translation efforts, specifically given we want to come across as unbiased and systematic and transparent practitioners that are trying to mobilize the best available evidence in an unbiased way to inform policymaking. The third relates to Fadi's 10th lesson learned, and that's about measuring impact and better evaluation. So while I think we're doing a relatively good job, and some of Fadi's policy tracing methods I think are going to be huge innovations in the field, we just haven't got far enough in terms of understanding the best ways to evaluate knowledge translation efforts. So my argument for the last few years has actually been we need to do a better job of designing theoretically informed multiple case studies to determine how these efforts are actually influencing the policy process across settings, while taking into effect all of the major institutional, interest-related, and ideational factors that matter in shaping policy as well. The fourth thing that popped into my head about areas for innovation are the new approaches that are emerging. So the citizen engagement piece is something that is now on the radar of many people. So we need to figure out what citizen engagement means, the best approaches for doing so, and how we can use this to complement our existing efforts that we've been now engaged with for years. In terms of capacity building, Fadi mentioned that we're doing that. My own experience, health system learning, the McMaster Health Forum, is that we're just learning about the best ways to approach capacity building. So many different ways in which we can formulate our efforts, such as whether we're presenting them in online formats, whether we're doing online combined with in-person. We need to learn more about the best approaches for capacity building for policymakers as well as different audiences. And finally, I think that we have a lot of innovative supports that can be considered from the inside of government. And what I mean by this are those things that we can support as experts in the field or practitioners from the outside for those that are working on the inside. And what I mean by this are some examples from Ontario. For example, they've established their own rapid response unit in the Ontario Ministry of Health. They also strike expert advisory groups, which is something that likely occurs in many governments around the world. They have a research evidence tool, which means that anyone submitting any policy briefing up to cabinet has to account for where they looked for research evidence to develop that briefing note. So there's a lot of area in the outside looking in and supporting those working on the inside of government for us to figure out innovative ways to ensure that there are processes and incentives in place within decision-making institutions to support knowledge translation. So those are my big takeaways from Fadi's presentation, as well as my own thoughts about where we're going. So I think there's lots of exciting things to happen in the next few years in the field.
That's great. Well, thanks very much, Kaelan. Those were excellent comments on Fadi's presentation, and certainly tied together very well. I think that what we'll do now is just open the webinar up to questions and answers. So if anybody has questions for either Kaelan or Fadi, please use the chat box on the bottom right-hand corner of the screen, and we'll go through the questions as they come in. So Fadi, the first question is from Malcolm, and he's asking whether the policy tracing method can be elaborated on.
Sure, thank you, Stephen, and thanks again, Kaelan, for articulating very important messages from the presentation. For the policy tracing, so what we have, we published two papers. We've evaluated two laws in Lebanon, one related to voluntary health insurance and one related to the nursing practice law. And we used, in the policy tracing technique that we used, we looked at the documentation analysis. So we identified really the key policy documents that are important to be reviewed and abstracted. And we used actually a tool. We developed a tool to actually abstract data from the document that we looked at. We've conducted interviews with key stakeholders, policymakers around that has been involved in those laws. We as well we conducted media analysis for a certain period of time before, during, and after issuing the laws. Thus, you can really understand. But one of the so there are some actually methods that is really out there to conduct policy tracing that focus on documentation review, media analysis, and stakeholder interviews. But I have to tell you, from our experience, this is really a major exercise, time-consuming sometimes. It consumes also a lot of resources, but it's extremely insightful when we conduct this. So in K2P, we might not have the capacity and resources to conduct policy tracing in all areas that we work on. But it's very important. For example, if we're now working on a certain law related, for example, to, let's say, clinical pharmacy in Lebanon. So this is where we kick in those tools and we start actually doing it in a very prospective way up until the law has been issued. And so we can really understand what happened, what type of evidence has been used, how it was used, and what made the decision to happen. So we do that in a prospective way, but also you can use policy tracing techniques to look in a retrospective way. So the voluntary health insurance policy that we evaluated, we looked back 15 years actually since year 2000 and to see what really happened and what made that decision happen and why that policy failed.
Great, that's excellent. So we have another question from Anastasia, just asking whether you can describe your methodology for conducting a rapid review. So I'm sure that Kaelan and Fadi, you both can probably comment on that one.
For the rapid review, in fact, we are just starting to scale up our operation for rapid reviews. So we are actually working very closely with the Center for Systematic Review in Health Policy and System Research. And also we are connected to an important team as well in Canada, where we actually working with them to build capacity for our team. Interestingly, now we are starting actually, last week we're starting to do our first rapid response, and because now K2P and Spark is providing support to the Lancet Commission on Syrian refugees. So there's the Lancet Global Commission on Syria, and Spark and K2P are key partners, and now we are actually working on producing the first rapid review on areas related to human resources health for Syrian healthcare workers.
Great. And Kaelan, did you want to just provide a little bit of an overview on our rapid response program?
Right. I think the two big things for me, and I would ask anyone that's really interested to connect with my colleague Mike Wilson about this, but the two big things for me are the process and what you're promising folks. So the first thing about process is you really need to engage with the person requesting the rapid synthesis early in the process to really work through what the problem is and the questions they want to have answered. Without getting that right, you're not going to prepare anything that's remotely useful to the folks on the receiving end. The second piece relates to what you're promising. So at the forum, we have 3 different formats, 3, 10, 30 business day rapid responses, and we're very clear about what they can expect on those different timelines. So in the 3 days, they're going to get a couple of pages of key messages from systematic reviews that are relevant to their question. 10 days might be a bit more than that with some efforts to contextualize that in the current policy context, whereas a 30-day report might look more like what we prepare as an evidence brief. So I think it's just really important to consider both the engagement in the problem definition as well as being clear with what you're offering.
Great, thanks, Kaelan. We have another question from...
Just to add to Kaelan's point as well, that we are actually using the same methods for 3, 10, 30 approach, and we've already produced, and I gave an example about the salt fluoridation law in Lebanon, where the minister asked, and we had really a certain number of days to respond. So, but we use the same methodology that I think you've already actually sent the link to.
Great, excellent. So the next question is asking whether we can elaborate more on multi-level engagement of different policymakers and stakeholders and how you'd coordinate that process. So Fadi, do you want to start with that, and then Kaelan maybe talk a little bit about the stakeholder dialogue program?
So for the multi-level, so basically when we actually work on a priority area, we really do stakeholder mapping. So we really map out all the key stakeholders at different level, at the political level, at the policy level, at the level of implementation, basically policy implementers and street level bureaucrats, as well as practitioners. Again, depending on the area of work or the priority, as well as international organizations, because in Lebanon, for example, we have a lot of UN organizations involved in delivering or financing certain health programs. So we map out all the stakeholders and we actually strategize. So basically, for example, when we do litmus testing for doing first of all engaging them in a priority, identifying the priority areas, we do interviews, we conduct priority setting workshops. But also when we start drafting the problem, looking at the underlying factors and the elements or options, we go and interview selected stakeholders to actually get their initial reflection on the problem, the framing, the evidence, as well as we engage them in the policy dialogue and post-dialogue activities. So, for example, we do personalized debriefing. We go to some offices. We go to parliamentarians. We go to ministries or ministers. So that what I mean by multi-level is that we actually engage different sets of stakeholders and policymakers throughout the spectrum, as well as we actually work with practitioners. For example, for the case of medical errors, interaction between or prescribing patterns, we have to engage practitioners and we have to reach out to practitioners as well in the healthcare setting, in primary care, in hospitals. So it all depends on the priority area or topic that we already identified.
Yeah, and I think our approach at the McMaster Health Forum is actually very similar to what Fadi just described. The one thing I'd add is that we tend to be quite selective during the process of establishing who's going to be invited to attend the dialogue. And in the last few months, actually, I found myself having to respond to this question quite a bit. And what we tend to do at the McMaster Health Forum is to make sure that those who are invited to the dialogue will be constructive, collaborative individuals who we know will engage in a conversation, be open to listening to others, and responding to them constructively rather than being sticks in the mud. So we try and make sure that the people we invite are known to be team players, willing to appreciate others' viewpoints, and to work collectively to a common goal. So that's our approach to that. And the way we do that is by establishing relationships with the groups that we use to put on our steering committees, as well as making sure that when we're asking people who they think would be great at a dialogue, we put that in front of them and say, do you know this person to be a constructive, collaborative individual, rather than someone who's just going to be abrasive and perhaps even not conducive to having a great dialogue.
That's great, Kaelan. That's certainly a good point. I think just to quickly elaborate on that, I mean, that's certainly a very important point when we're setting up the dialogues, but just to follow from that, after the dialogues are completed as well, that we definitely make a point of following up with all of the attendees, but also all the people that were on the steering committee and help to contribute to writing the brief, as well as sharing the results from the dialogues through our own newsletter, through social media, and other knowledge translation groups, so that we can not only share the information with the group that helped to make the request and was initially interested, but also to reach a bit of a broader audience. We have one more question here from Liam, who asked, how do you balance the need to ensure that you remain viewed as an unbiased support for policymakers while at the same time building trust and relationships with them? Is there a specific approach or process that has been established?
Thank you for the question. I have to tell you, it has not been easy. This is quite difficult, challenging, and tricky, in fact. And the, you know, my answer or my take into that is really it all depends on the policymaker that you're dealing with. Yes, I have to tell you, and I admit, we had cases where policymakers, they've seen us maybe as an opportunity to push for certain policy options or solutions that serve their agendas, but not necessarily really serve the public good or the collective type of interest. And we had to walk away. We had to actually, in some cases, there was, and this happened with us usually at the level when we do litmus testing and we start engaging them in interviews or setting certain priorities. And I think with time, we have again success stories, but also we have cases where, in fact, it has been really challenging to establish that relationship with certain policymakers in certain priority areas. The funny thing about it is that the same policymaker or the same policymaking institution can work very well with you in an objective way, and we keep an arm's length when it comes to that interaction on certain priority areas. But there are some other priority areas that, in fact, they are not ready to make some radical or dramatic change in their policies or in their direction for certain reason that goes beyond evidence. So for certain political reasons. And now we're starting to understand that you can still build a certain relationship and maintain a level of objectivity as well as build that trust and sustain it, but sometimes we have sometimes to agree to disagree. So we're starting to learn that, and it seems that also some of the policymaker institutions now they are starting to get used to us that when we feel that objectivity will be compromised, we're walking away. I'm not saying this is the best approach, but I think this is something that we are really learning from. It's so easy if we are too much receptive or responsive to what they need. Sometimes, unfortunately, with all the respect to policymakers, but sometimes policymakers voice and put some priorities out there that might not reflect the real priorities. And we have also to be careful about this. So it's tricky. It requires a lot of thinking, prioritization, a lot of vigilance about the political climate in the country. And again, Lebanon, we have a very complicated democratic system. This what I'm saying now might not apply in other countries or in other contexts. So my answer to that, there's no specific approach. I think it's a case by case basis. But the one thing that we so far we haven't compromised is the level of objectivity. And I think we're starting to get known in Lebanon among policymaking institutions that this is a credible center. This is a center that says things in a truthful way, in a factual way, evidence-based way. And yes, remains neutral. It takes time to build that reputation. We're still working on that, and we are working very hard not to actually to always work according to this principle.
Great. Kaelan, did you have anything to add to that before we wrap up today's webinar?
No, just a very quick comment. I think Fadi's hit the nail on the head, and I'd like to just establish kind of the point that we take at the forum is that everything should be systematic and transparent. So whatever you do, whatever approach you take, make sure that it's systematic, transparent, and that you're repeating it every time. So you're basically reacting to the policy context in a similar way each time with a similar process. So you're not tailoring your approach to getting the evidence, packaging it, synthesizing it, sharing it at a dialogue to fit the needs of policymakers. So you're very clear about what your group is offering from a method standpoint. So that's all I would add.
Great. Well, I'd just like to say thanks again to Fadi and Kaelan for taking the time to join us today, and for everybody that joined the webinar. We very much appreciate it. We will be holding more of these top 10 webinars during 2017. We have not quite scheduled any yet, but we will be doing so shortly. So please check out the McMaster Health Forum website for more information, or you can always check out the MHF Top 10 hashtag on Twitter for more information. So thanks again to Fadi and Kaelan and for everybody else who really appreciate it. It was a great discussion and look forward to having all of you join us again for another webinar. Thanks.
Thank you.